My name is Tiziano Scarabelli. I am a senior faculty member at University of Alabama in Birmingham and director of the Center for Heart and Vessel Preclinical Studies based at St. John Hospital, a big teaching hospital affiliated with Wayne State University. I am a cardio-oncologist, and so I am dealing with cardiac complication related to chemotherapy and or radiation therapy given to patients with cancer. The study I wanted to share with you is a study which has been carried out in an experimental animal model, a rabbit model more specifically, but stemmed from a very simple and straightforward clinical observation. People with multiple myeloma, cancer of the blood, during the infusion of a specific medication which is called CARFILZOMIB, proteasome inhibitor, in some cases developed chest pain, which was associated with release in the blood of circulating markers of ischemia, such as troponin, as well as alteration of the electrocardiogram going towards an ischemic direction. So these people, which are seldom treated by left heart catheterization because of the kidney issue they concurrently have been nonetheless sent to the cath lab because of the high risk of significant coronary artery disease. And despite all what I've told you so far, they have been found to have clean coronary arteries. So that stemmed the observation that CARFILZOMIB, this powerful medication FDA approved for the treatment of relapsing or refractory multiple myeloma, may exert some unwanted action on the coronary circulation. So what we did was to work on this rabbit model of disease, isolating the heart from the animal after the sacrifice of the animals in question, as well as the isolation of the thoracic tract of the aorta. What we have seen is that in the isolated and Langendorf perfused rabbit heart, CARFILZOMIB induced a significant increase in the coronary perfusion pressure and coronary resistance, while did not affect the cardiac contractility or the heart rate. The aortic strips taken from the animal have been also challenged, incubated with CARFILZOMIB, and we have seen that CARFILZOMIB induced a significant increase in the vasoconstrictory tone. It increased the spasm induced by well-known spasmogenic agents such as potassium chloride, noradrenaline, and angiotensin II, and finally significantly reduced the vasodilatory action exerted by medications such as nitroglycerin and nifedipine. So this is very important because it will give us the ability to go back to the bench as well as to carry out additional study to verify whether the infusion of this drug, namely CARFILZOMIB, in patients with multiple myeloma is safe, above all in patients who have already a history of coronary artery disease and in patients where there has been a documented predisposition to develop coronary spasm in different situations. So we are carrying out additional study at the moment, going back to the bench via a pharmacological study as well as a molecular part of the study, and more importantly, a clinical trial, which will be started promptly.